perforated peptic ulcer. A surgery has been scheduled and a nasogastric tube is inserted. The nurse should place the client before surgery in a. Dorsal recumbent position. B. Semi-Fowler's position. C. Sims position. D. Supine position. Correct answer. Semi-Fowler's position will localize the spilled stomach contents in the lower part of the abdominal cavity. Which of the following symptoms during the icteric phase of viral hepatitis should the nurse expect the client to inhibit? A. Yellow sclera. B. Watery stool. C. Tarry stool. D. Shortness of breath. Correct answer. Liver inflammation and obstruction block the normal flow of bile. Excess bilirubin turns the skin and sclera yellow and the urine dark and frothy. A client suffered from a lower leg injury and seeks treatment in the emergency room. There is a prominent deformity to the lower aspect of the leg, and the injured leg appears shorter than the other leg. The affected leg is painful, swollen and beginning to become ecchymotic. The nurse interprets that the client is experiencing a. Contusion. B. Sprain. C. Strain. D. Fracture. Correct answer. Common signs and symptoms of fracture include pain, deformity, shortening of the extremity, crepitus and swelling. Mrs. Chua, a 78-year-old client, is admitted with the diagnosis of mild chronic heart failure. The nurse expects to hear when listening to client an RS quo, S lungs indicative of chronic heart failure would be a. Friction rubs. B. Wheezes. C. Crackles. D. Stridor. Correct answer. Left-sided heart failure causes fluid accumulation in the capillary network of the lung. Fluid eventually enters alveolar spaces and causes crackling sounds at the end of inspiration. Patrick, who is hospitalized following a myocardial infarction, asks the nurse why he is taking morphine. The nurse explains that morphine a. Dilates coronary blood vessels. B. Prevents shock and relieves pain. C. Decrease anxiety and restlessness. D. Helps prevent fibrillation of the heart. Correct answer. Morphine is a central nervous system depressant used to relieve the pain associated with myocardial infarction. It also decreases apprehension and prevents cardiogenic shock. A female client is taking Cascara Sagrada. Nurse Betty informs the client that the following may be experienced as side effects of this medication. A. Partial bowel obstruction. B. Abdominal cramps. C. GI bleeding. D. Peptic ulcer disease. Correct answer. The most frequent side effects of Cascara Sagrada laxative is abdominal cramps and nausea. Nurse Lucy is planning to give preoperative teaching to a client who will be undergoing rhinoplasty. Which of the following should be included? A. Aspirin-containing medications should not be taken 14 days before. Correct answer. Aspirin-containing medications should not be taken 14 days before surgery to decrease the risk of bleeding. Paul is admitted to the hospital due to metabolic acidosis caused by diabetic ketoacidosis (DKA). The nurse prepares which of the following medications as an initial treatment for this problem. A. Potassium. B. Sodium bicarbonate. C. Correct answer. Metabolic acidosis is anaerobic metabolism caused by lack of ability of the body to use circulating glucose. Administration of insulin corrects this problem. A client who has been diagnosed with hypertension is being taught to restrict intake of sodium. The nurse would know that the teachings are effective if the client states that in HELP. A. I can eat spaghetti on rye bread. B. I can eat shredded wheat cereal. Century. I can eat broiled scallops. D. I can eat celery sticks and carrots. Correct answer. Wheat cereal has a low sodium content. During the first several hours after a cardiac catheterization, it would be most essential for Nurse Cherry to inhale a. Frequently monitor client and RS quo, S apical pulse and blood pressure. B. Instruct the client to cough and deep breathe every 2 hours. C. Elevate client's bed at 45 and deg. D. Monitor client's temperature every hour. Correct answer. Blood pressure is monitored to detect hypotension, which may indicate shock or hemorrhage. Apical pulse is taken to detect arrhythmias related to cardiac irritability. A 68-year-old client is diagnosed with a right-sided brain attack and is admitted to the hospital. In caring for this client, the nurse should plan to a. Use a bed cradle to prevent dorsiflexion of feet. b. Use hand roll and extend the left upper extremity on a pillow to prevent contractions. Correct answer. The left side of the body will be affected in a right-sided brain attack. Among the following signs and symptoms, which would most likely be present in a client with mitral regurgitation? A. Increased creatine phosphokinase concentration. B. Exertional dyspnea. C. Altered level of consciousness. D. Chest pain. Correct answer. Weight gain due to retention of fluids and worsening heart failure causes exertional dyspnea in clients with mitral regurgitation. What would be the primary goal of therapy for a client with pulmonary edema and heart failure? A. Peripheral edema decreased. B. Improve respiratory status. C. Increase cardiac output. D. Enhance comfort. Correct answer. The primary goal of therapy for the client with pulmonary edema or heart failure is increasing cardiac output. Pulmonary edema is an acute medical emergency requiring immediate intervention. Which of the following should the nurse teach the client about the signs of digitalis toxicity? A. Elevated blood pressure. B. Skin rash over the chest and back. C. Visual disturbances such as seeing yellow spots. D. Increased appetite. Correct answer. Seeing yellow spots and colored vision are common symptoms of digitalis toxicity. Nurse Linda is caring for a client with head injury and monitoring the client with decerebrate posturing. Which of the following is a characteristic of this type of posturing? A. Extension of the extremities after a stimulus. B. Upper extremity flexion with lower extremity extension. C. Upper extremity flexion with lower Correct answer. Decerebrate posturing. Jerry has diagnosed with appendicitis. He develops a fever, hypotension, and tachycardia. The nurse suspects which of the following complications? A. Bowel ischemia. B. Peritonitis. C. Intestinal obstruction. D. Deficient fluid volume. Correct answer. Complications of acute appendicitis are peritonitis, perforation and abscess development. In reducing the risk of endocarditis, good dental care is an important measure. To promote good dental care in client with mitral stenosis, in teaching plan should include proper use of an HELOP. A. Manual toothbrush. B. Electric toothbrush. C. Dental floss. D. Irrigation device. No. Correct answer. Dr. Marquez orders a continuous intravenous nitroglycerin infusion for the client suffering from myocardial infarction. Which of the following is the most essential nursing action? A. Obtaining infusion pump for the medication. B. Obtaining serum potassium levels daily. C. Monitoring blood pressure every 4 hours. D. Monitoring urine output frequently. Correct answer. Administration of intravenous nitroglycerin infusion requires pump for accurate control of medication. Nurse Perry is evaluating the renal function of a male client. After documenting urine volume and characteristics, Nurse Perry assesses which signs is the best indicator of renal function. A. Pulse rate. B. Distension of the bladder. C. Blood pressure. Correct answer. Perfusion can be best estimated by blood pressure, which is an indirect reflection of the adequacy of cardiac output. George, who has undergone thoracic surgery, has chest tube connected to a water seal drainage system attached to suction. Presence of excessive bubbling is identified in water seal chamber. The nurse should inhale. A. Recognize the system is functioning correctly. B. Check the system for air leaks. C. An LEDQO, strip an REDQO. Correct answer. Excessive bubbling indicates an air leak which must be eliminated to permit lung expansion.